Hey everyone. Welcome to the introductory episode of a podcast brought to you by Urology Times called First Assist GU Oncology Unpacked. I'm your host, Taylor Goodstein. The purpose of this podcast is to bring you a wide range of oncology topics, from guidelines to expert insights and discussions on key issues that are happening in the field right now. I'm coming at you from a bit of a unique host perspective. I've just finished my residency at The Ohio State University last year, and I'm about to start my second year of my SUO fellowship at Emory. So I'm not a resident, but I'm not an attending. I kind of exist in a gray area, and although I've learned a lot about oncology over the last couple of years, I still have a long way to go. And I'm close enough to my training to remember how intimidating it can be for trainees to get interested in oncology. There's just a huge amount of knowledge that you have to know. The barrier to entry feels really high, and at times it feels really intimidating, if not impossible. So my goal is to kind of try to dispel a lot of that. I am passionate about medical education, specifically training medical students and residents, which is why I wanted to bring this podcast. Now, just because it is geared towards trainees doesn't mean it's not going to be relevant for experts within the field of uro-onc. I'm going to be asking a lot of questions that you might be too afraid to ask, like, what is CIS anyway? Or what does a cycle of chemotherapy entail? In order to answer these questions, I'm going to be interviewing oncology experts from around the country. Some of our topics will include things like which new trials are happening in non-muscle invasive bladder cancer, to understanding focal therapy in prostate cancer, to how to kind of prepare yourself for performing your first IVC thrombectomy. I'll be talking to urologists, radiation oncologists, medical oncologists, and even basic scientists. With that, I am looking forward to seeing you all back for our first episode. The first series of episodes we're going to do is going to be a historical context, looking at how treatment has evolved for some of our most common malignancies. I think this is an important topic because in order to know where the field is going, it's important to understand where it came from. So that's what we'll be focusing on initially, but we will have different types of episodes kind of interspersed throughout. And I also welcome any topic suggestions, for which there will be a link at the bottom of this video. Tell me what you want to know about. What do you find confusing? And we'll talk about it on this podcast. If you want to follow me on social media, my Instagram is Dr. Badstein and my Blue Sky is at T Goodstein. Thanks so much for tuning in to this introductory episode. And we'll see you back for episode 1 of First Assist.